the Director of Public Information and Civic Engagement for the City of Springfield. We are coming to you from the Greene County Public Safety Center. This is the home of both the Office of Emergency Management and 911 Emergency Communications Center. Thank you for joining us this afternoon. We have a lot of territory to cover today, so I'm going to provide an overview of today's briefing before we get started. Health Director Clay Goddard will provide an update on COVID-19 and our efforts to prevent, contain, and mitigate the virus. Mayor Ken McClure will announce the Phase 2 Road to Recovery Order, which details changes to what is allowed beginning May 23rd. City Manager Jason Gage is with us today. He will walk us through the full Road to Recovery plan that projects into July what might be the possible next few steps. Over the next 2 to 3 weeks, we will evaluate our local health data to see if our assumptions match real information. Then we can determine how best to balance local health and our community activities. We have a lot of territory to cover today, so first up, I'm going to welcome our Health Director, Clay Goddard.
Thank you, Cora. Good afternoon, everyone, and thank you for joining us today. We are here to announce the next step of the city's phased-in plan for the gradual reopening of our community. Since we first announced the Road to Recovery plan on April 30th, we have continued to receive helpful and constructive feedback from the community, and I want to thank our community for that feedback. It's very important to us. Throughout this response, we have told you that COVID-19 dictates our timeline and that data drives our decision-making. We have continued to watch the data and collect more insight on the prevalence of this disease in our community, and because of this, we feel confident that it's the right time to enter Phase 2. To talk a bit more about what comes with our Phase 2 plan, I'll turn things over to our Mayor, Ken McClure.
Clay, thank you. Good afternoon, and good afternoon also to our friends in the media, and thank you once again for the excellent job which you are doing in providing good, sound information to our community. Every time I step to this podium, I experience a variety of emotions, and today is no exception. Every bit of good news we bring to you is offset at least by some element of risk, and even in some cases, a bit of bad news for some of our people. Our decisions are made with a lot of thought, prayer, reflection, angst, and input. We trust our stakeholders who dialogue with us, and we take pride in listening to a variety of opinions from diverse point of views. This is indeed a great city. We were poised before this pandemic to do great things, and after it is a distant memory, we will still do greater things together once again. I am proud of each of you, you who are doing what it needs to be done to preserve safety and life and to take care of both yourself and your families, whether they work at home or whether they are actually out in the trenches with our healthcare providers and first responders. We're very proud of all of them. Today, we are fulfilling our promise to open the economy a little further, while our sophisticated public health professionals and the medical experts they work with keep a very watchful eye on the repercussions. As Clay continues to say, the virus is still out there. We need to do what we can to stop it in its tracks. The Road to Recovery order announced today will allow for the expansion of certain activities to occur in larger numbers. The previous and successful stay-at-home and Phase 1 orders taught us that we can, and we did, repress the spread of COVID-19 in our community. That allowed our hospital and our public health systems to scale up and our entire city to be more ready should a terrible surge yet occur. I'm going to hit some of the highlights, but the full order and the additional educational materials can be found on our website at springfieldmo.gov. Today's Phase 2 order moves beyond the restriction of a set number of people allowed for activities to new rules that require use of a percentage of occupancy based upon a formula created to maximize physical distancing. For example, religious services, conferences, exhibitions, attractions, and other enhanced risk activities will be able to accommodate additional people given certain safety parameters which must be followed. Occupancy allowances are determined by measuring the space where the activity is to occur, divide it by 30, and multiply that by 25%. The solution to that formula will get you the number of people allowed in that space at any one given time. This general principle now applies to other activities that have been prohibited or greatly restricted during Phase 1, such as weddings, funerals, and concerts. Those who wish will be able to swim, weather permitting, on Memorial Day, given that those who come together do so at the 25% limit. Entertainment venues which are ready to come back, the patrons there will be able to do so, again using the occupancy formula and employing strict CDC guidelines for physical distancing and hygiene. Not all businesses, venues, or religious congregations are ready for this step. I understand that and continue to encourage individual and organizational responsibility when making plans to open or to open further. Every person and every organization is different, and the risks are different too. A few more details. First, the order issued today will become effective at 12:01 a.m. on Saturday, May 23, instead of May 26. This puts the new rules into effect prior to the Memorial Day weekend and is being made based upon input received this week from a variety of interests throughout the city, wishing that the order would be in place prior to the holiday weekend. I wish more notice could be given prior to the effective date, but given the volume of work involved in preparing this order as well as processing all of the data and the input received, this is the best timing. Second, the order will be in effect for 30 days or through June 22. This matches the time limitation contained in City Code and makes additional amendments easier. Third, that being said, the Phase 2 that we are announcing today will run from May 23 through June 14 unless conditions warrant additional modifications, hopefully continuing to step down. Phase 2 itself is not changed with regard to the sporting events, but Phase 3, which is not included in this order, modifies the provisions for contact sports activities and practices to allow them effective June 15 with a 50% occupancy limitation. This approach allows the contact sport activities to resume this summer. Springfield Greene County Park Board between now and June 15 will be working to prepare its facilities for contact sport activities, including the hiring and the training of necessary staff, umpires, etc., the things that go with those type of activities. This is a very positive order, but with it goes the continued personal responsibility. Each of us is responsible for making sure that we take the appropriate safety precautions, not only for ourselves, but with those with whom we come in contact, including our family members. So I encourage each of you, continue to take good, sound safety steps as you monitor your own activities. Watch where you go. Don't take trips unless you need to, but when you do take trips, be safe. So with this order, we're taking the next step forward. I'm very proud of our community. We continue to make good progress, and the progress we're making now is because we took good, strong, effective action in March when we needed to. Thank you very much. Let me now introduce my colleague, City Manager Jason Gage, who will provide more information as we step through what our Road to Recovery plan looks like.
All right, thank you, Mayor. My name is Jason Gage. I'm the city manager, and I'm going to take you through the various step-down aspects. But before I do that, we're going to have our Springfield Greene County Health Director, Clay Goddard, talk about the dashboard and give everyone an update as to where we are right now. Clay?
Thank you, Jason. Thank you, Mayor McClure. From day one, it's been our goal to navigate a safe reopening of our community. We've been continuously monitoring the spread of this disease and have taken action to mitigate and contain it. Our testing capacity has dramatically improved, giving us a better window into this disease. And today we are confident that our community is ready for Phase 2. As we've mentioned before, these following phases are subject to change as circumstances evolve and as we follow the data. What we are closely watching from a data and capability perspective is publicly available on our recovery dashboard. It covers 5 key areas. Those include detailed case information, hospital capability, public health capability, testing capability, and regional data. Yesterday, we introduced our revamped local case dashboard, which breaks down detailed information on COVID-19 in our community. It looks different than you might remember in that we've begun reporting probable cases separately from lab-confirmed cases. On this revised local case dashboard, you will see 3 different categories: confirmed cases and deaths, probable cases and deaths, or currently 1 death, which is the EpiLink death we had previously reported, and total cases and death. Our confirmed cases reflect positive PCR test, which is a genetic test conducted with a swab. It's the one that gets inserted into your navel cavity or nasal cavity or to the back of your throat. If a person tests positive, this means they are currently infected with COVID-19, and I consider PCR testing to be the gold standard for testing for this disease. Probable cases are cases linked to antibody test, which is a blood test, or EpiLink cases where the patient has had contact with 1 or more people who have either had or have the disease and meet current case definition. I want to reiterate that PCR test and antibody test are not apple-to-apple comparisons. A PCR test will tell us that you have COVID-19. An antibody test tells us that you may have had COVID-19 at some point. We aren't entirely sure yet if antibody test, and there are a lot of different ones on the market right now, are telling us that you have COVID-19 or have had it at some point, or that some other type of coronavirus might be triggering the test. And keep in mind, coronaviruses are a diverse family, which includes viruses that cause the common cold. If a person has a positive antibody test and after investigation meets general case definition, the CDC classifies this as a probable COVID-19 case rather than a confirmed case. This is because we don't yet have as much confidence in this test and whether those results are valid. We would advise, however, at the very least, that if you're going to pursue antibody testing, make sure you do your research and find a test that the FDA has given emergency use authorization for. There are a lot of tests out in the marketplace right now, and we are especially skeptical of those that don't have FDA authorization. We hope our community will find this information valuable as we work together to keep ourselves and each other healthy. I also want to remind you of our recovery dashboard, which can also be found on our website, health.springfieldmo.gov/coronavirus. Here we have a tool to track our capability scores. It's similar to a gas gauge. The further to the left it goes towards 0, the less capability our community has to fight COVID-19. The further right it goes towards 10, the greater the capability. We use these scores to determine how prepared our community is to fight the 3 aspects of our response to COVID-19. And although some people may want to be concerned about our new case numbers from yesterday, I want to assure you that we are confident in our community's ability to handle these new cases. We feel good about where we are as a region. However, I do want to point out that we are closely watching the recent spikes in cases at churches and other community groups in surrounding states and across the country. I know a lot of people regularly ask me about the safety of going to the grocery store, but I'll point out that we're not hearing about outbreaks from a trip to a store. It goes back to that density and intensity equation. You see these big headlines about group gatherings, but it's groups of people coming together for extended periods of time that pose the biggest risk during this pandemic. We should all continue to keep that in mind and alter our behaviors accordingly. I would again just reiterate that our community is shifting from a phase with mandated restrictions and limitations to a phase of this response that calls on all of us to exercise our own personal responsibility. Each of us owns how this will move forward. Each of us has to be thinking about the good of ourselves, the good of our families, and the good of our community. I'll now turn it over to City Manager Jason Gage to map out the future of our recovery plan.
Thank you, Clay. I get the privilege to talk about something positive as well as the mayor and Clay, and that's as we go into recovery. And that's a good thing. And we know that people are looking for some positive news, and we're happy to bring some. So first I'll talk a little bit about the phases and the timeline. And just a reminder that the community went into a stay-at-home order back on March 26th, and the first part of that took us through May 3rd. And then we went into a phase 1 recovery May 4th through the 25th, but we did tweak that some. The mayor was able to look at that, look at the data, and make some change. We call that phase 1A, and that was implemented on May 7th. So that was a happy change that we were able to make at that point in time. As we look at the future and the road to recovery, we're looking at three different phases here, three additional phases, phases 2, 3, and 4. Phase 2 is intended to begin and will begin on May 23rd and is intended to go through June 14th. Phase 3 will begin on June 15th and is expected to go through July 5th. Phase 4 will begin on July 6th and is expected to go through July 23rd. At mid-June, we do want to take a look at our data, see where we're at as a community. Hopefully we'll be in a more positive place, and that will help us then decide what the next phase will look like, what phase 5 might look like. Some of you may notice that's I believe the day before the scheduling of the Ozark Empire Fair, and we do think, quite honestly, that phase 4 does lend itself towards fair activities, but we do want to wait and make a decision on phase 5 until we have some additional data, and we hope to have that towards the middle part of June. So one thing I'd like to say is, as the mayor went over phase 2, the phase 2 is our upcoming phase that'll be in place here very quickly. That was explained in the handy chart that you saw on the screen, and that's part of our Road to Recovery Plan document, and that document is available on our website. And what it does is it'll show two different ways of looking at the information: by phase, where a person can look at a single phase and look at multiple activities, or by a single activity where a person can look at multiple phases. So we want to make that simple for people. Just a reminder, too, that the Road to Recovery Plan is a guide. It's a guide to the Springfield-Greene County area's next phases in opening up the local economy. The individual components and phases are subject to change, and we hope if they do change, it's in a positive way. We hope that we're doing well as a community, that our community continues to take this seriously as they have, and that we're able to bring even more positive results later. That's what we hope we can do. But it is subject to change, and that change is related to the measures that are tracked on the Springfield-Greene County Health Department's COVID-19 community dashboard that you just saw. The Road to Recovery Plan is a framework. It's a framework for our Springfield Mayor McClure's reopening orders. The orders are the legal documents that establish what we will do for a period of the time, but the framework allows people to know what we're thinking, to be thinking ahead with us, and have an idea of where we might be going. And that way it allows folks to start planning, allows businesses to start planning, and organizations to start planning what they may want to do. They'll have a firm understanding of what the recovery looks like. They'll be informed by the dashboard that lets us know when the spread of the disease is controlled and what healthcare, public health, and testing capabilities are strong. Within this framework, decisions are made approximately every 3 weeks. And so we feel like a 3-week time frame allows us to have that accurate information and to be looking to the next step. So with that, I'll walk everyone through the plan. I'll try to do that in a fairly brief time frame here, and I'll do that as it's broken down by sectors of the community. So just to cover the categories that I'll be speaking of, and the intent of the plan is to really simplify this because the order is a little bit more formal and it's organized a little differently. The plan is going to be, I think, easier for most people to understand, and it's a quick, handy document. So the categories include restaurants and bars, entertainment venues and museums, essential retail and non-essential stores and businesses, personal care services, gym and fitness centers, playgrounds, pools, trails and parks, sports and sporting events, child care camps, private schools, religious services, weddings and funerals, long-term care facilities, and some recommendations for all residents. So I'll go through this by category and start talking about what the changes that people should expect to see. So starting with restaurants and bars. In Phase 2, as the mayor mentioned, the dine-in service will be at what we call a 25% occupancy capacity. That it will be calculated based on a formula that was provided to us by the state of Missouri when they first brought that formula into for retail establishments. And so when we talk about 25%, basically what that means is as a business would look at the area that the activity is going to occur, they would divide that area, that square footage, by 30, and then multiply it by 0.25 if we're talking about a 25% occupancy. If we're talking about a 50% occupancy, they'd multiply that by 0.50. And then later there is a category, you'll see a 10% occupancy, and that's obviously divided or multiplying by 0.10. So as we look at Phase 2 for dine-in service for restaurants is at a 25% occupancy limitation, both apply to indoor and outdoor seating, because we wanted to allow outdoor seating. As we go to Phases 3 and 4, they're very much the same, except the occupancy percentage will change from 25% to 50% in both of those phases. You will see as I go along some similarities between Phases 3 and 4. We wanted to have a look in between and not have a phase that's too far out, but you will see similarities at that time. And again, if information is more positive, it's possible we could change that Phase 4 number. With regards to counter seating, it really is the same from Phase 2 through Phase 4. No counter seating or self-service buffets are allowed during this time. We think that helps keep people spread out. Bars, nightclubs, and microbrewery tap rooms are open, again, in Phase 2 at the 25% occupancy limitation based on that formula, and would also go to a 50% formula both for Phases 3 and 4. So, and you'll see a lot of similarities in these. I'll be somewhat repeating myself, but I think it's a good thing as we are able to start treating a lot of the uses in a similar way. It simplifies it for people. So the next category is entertainment venues and museums. And these are things like movies, bowling, gaming. It also includes classes, conferences, seminars, and those types of activities. In Phase 2, we're again at a 25% occupancy limitation in the same way I mentioned for the last category. That is the same for the movies, bowling, games, those types of things, and also for museums. They're both looked at the 25% occupancy in Phase 2. Both of those in Phases 3 and 4 are planned to go to a 50% level, similarly to what I discussed earlier. So those are very similar to what we just talked about with restaurants and bars. The next category includes playgrounds, pools, and parks. I guess the 3 Ps. Right now we have for Phases 2, 3, and 4, playgrounds are open. So that's good. Kids can get outside, can enjoy the air, the sunshine, get some exercise. That's a good thing. And I know our Parks Director, Bob Belote's happy about that. Pools. Pools are going to be allowed to operate at the beginning here on May 23rd. With Phase 2 at a 25%, call that a bather load of the pool. I could spend all day talking about what a bather load is, but I won't. Those who manage pools know what that is, and if they have questions, they can contact us, contact our park board, and we'll help them with that, or our health department as well. We can get them the answers there. In Phases 3 and 4, that'll go to a 50% bather load of the pool. Our parks and trails are open, will continue to be open at this point for all phases. So again, a very good thing, getting people out. We encourage people to get out. It's a great opportunity to do that. I'll hit the sports and sporting events. This one has garnered a lot of attention recently, as you might expect, with nice warm weather, and it's that time of year. So in phase 2, then I'll first talk about non-contact sports. There are sports there is no contact or folks not needing to get close together. For non-contact sports practices and activities, they are allowed with a 25% occupancy limitation based on the square foot for spectator area. It's non-contact. We know that people are capable of social distancing. We're not worried about it. With those who are participating, the focus is on the spectator seating area. And in phases 3 and 4, that spectator area percentage of occupancy goes up to 50%, as we mentioned in other categories. So it's pretty simple. For contact sports, in phase 2, the mayor mentioned the non-contact practices for contact sports. So you can have a contact sport, but you don't have to have a contact practice. You can do drills and things like that. The non-contact practice aspects are allowed with no more than 25 people coordinated in stable separated groups. The point of that is that you could have multiple teams, perhaps, in a large recreational property, and it doesn't make sense on a large property to limit just to 25, so it's about the group size, and we think that makes sense. So a team can practice, they keep their social distancing, not have contact, but we can then accommodate multiple teams in a larger location that way. In phases 3 and 4, we do have some changes. We go from that flat 25 coordinated stable group limitation in phase 2 to a 50%, well, to contact sports and activities and practices being allowed in phases 3 and 4. And then we do begin to focus there more on the spectator part of that at a 50% occupancy limitation based on the formula for spectators, both for phases 3 and 4. So again, early on in phase 2, non-contact practices of contact sports allowed with a flat 25 person stable group. But in phases 3 and 4, the contact sports activities and practices are fully allowed, and the focus goes to spectator areas at 50%. Essential retail and non-essential stores and businesses. We continue to use the non-essential aspect. That's how we started with our order, and it makes sense to be consistent with that. In phase 2, for those types of businesses, they are allowed with a 25% occupancy or 10% occupancy limitation based on square footage. If the size, and that's based on the size of the facility. If the size of the facility is greater than 10,000 square feet, then they're at the 10% level. So if you think about a big box store, that might be a good way to visualize that. If the size of the facility is less than 10,000 square feet, they can be at the 25%. Those are the percentages that are in place right now under the state of Missouri order. And as a city, we have the ability to be more restrictive, but we cannot be less restrictive. So at this point in time, we will use the 25%, 10% approach because that is consistent with the state of Missouri. Now, if the state of Missouri's order should change, we have the opportunity and the possibility of potentially changing with that, or just changing it using that as a trigger. So, not yet knowing what the state of Missouri will do, our plan for phases 3 and 4 would be to take that percentage to a 50% level, again in the same way we have with other categories. So, pretty similar approach to essential retail, non-essential stores and businesses. The next category is personal care services. And right now, or I say right now, as of May 23rd in phase 2, those will be allowed with a 25% occupancy limitation, same formula. The main difference here is personal care services. Employees are expected to be masked when they're within that 6 feet distance. We realize it's very difficult to cut hair, paint nails, or do other things at a 6 foot distance. And I can tell you I wouldn't want anyone cutting my hair at a 6 foot distance. So we recognize that, and that's why we do require the wearing of the mask for those services. Again, similar to other categories, as we hit phase 3 and phase 4, that 25% will go to a 50% level, and again, the requirement to wear a mask is still in place because of that close distance. The next category, gyms and fitness centers. We know a lot of people, a lot of folks who like to spend a lot of time in gyms, and they're ready to go back. Under phase 2, that's again at a 25% occupancy limitation and formula for both the gyms and fitness centers and classes. We had previously looked at classes a little bit differently, and now we're bringing that together. So we look at the total gym activity package the same way at a 25% level, a formula for that square footage. And again, in phases 3 and phase 4, that goes to a 50% occupancy level as well. So again, you're seeing a lot of similarities in how we think we're able to handle this, and that simplifies our approach. Next category includes childcare, camps, and private schools. I'll start with childcare. Childcare under Phase 2 on the 23rd, the daycares are open with a limitation of stable groups of not more than 25. That's consistent with where we are today. With Phase 3 in mid-June and presumably Phase 4, the daycares could be open with no group size limitation. So we're anticipating our numbers will be good. We hope they are, our health numbers. If they're not, we'll go back and take a look at that. But right now we're being very optimistic there, and we think we'll be there. As we look at day camps, pretty similar. Day camps are open if the primary role is child care, and they have a limitation of stable group size of 25 as well, just like the child care. And that stays the same through phases 3 and 4 as well. The school's emphasis is a little bit different. Before in our orders, you've seen it be related to academic activities or instructional activities, and public schools are really the domain of the state of Missouri, so our focus is on private schools. We hope to match up the best we can. We'll have to wait and see what happens and what the governor's order provides for public schools. But private schools will remain closed under the Phase 2 starting on May 23rd. But according to our plan, would be allowed to reopen in Phase 3 on June 15th, and hopefully remain open from that point forward. Again, we'll see what happens with public schools when the new state order comes out, and it's a possibility we may match up with that. We'll just have to see what that information includes. The next category includes religious services, weddings, and funerals. Now, I'm going to emphasize weddings because before we've talked a lot about religious services and funerals, but we haven't included weddings, and so we want to include weddings. It makes sense to do that, we think, right now. In Phase 2, in-person services are allowed, so May 23rd, to operate with a 25% occupancy limitation. Today, if it was happening today, it's 25 people max. So to go from a 25-person limit to a 25% it really provides some flexibility for religious services and certainly for weddings that weren't allowed, and also provides the same flexibility for funeral services. So 25% in Phase 2, same formula. In Phases 3 and 4, those all would go to 50%. Again, assuming all of our health data is positive, as we hope and expect it to be. We think that'll provide some needed flexibility. Long-term care facilities, right now we are still showing in all phases no visitors permitted. We're very concerned about what happens in long-term care facilities when the virus is brought in, and we know we have an extremely high-risk population in those facilities, so we're going to be very protective of those facilities. It's a recommendation of our city-county health department, and we think that's a great recommendation. Public gatherings, this category has changed. Before, public gatherings was almost a catch-all for what didn't fit in other categories and could include any type of spontaneous or semi-planned public gathering. And as we look at it today, right now today, that's a limitation of 25 people, and it's a much broader net. What we're trying to do is we believe that that the categories that I've just listed will catch practically every activity out there, and we can address it with the percentages that we just talked about with that formula. So we've really changed the style of this, and the public gatherings, our focus will be on special events, and they will be on city property or streets that would require a permit from the city. So it's really much more narrowly focused to those types of activities. So city property or streets requiring a permit from the city. For Phase 2, starting May 23rd, no special events of more than 50 people on city property or streets requiring a permit or per city code. Phase 3 and Phase 4, the number stays the same at this point in time. Again, we have the opportunity as we look at health information later to decide if we can loosen that up, but we want to be pretty strict as it relates to the city property and the use for activities that are fun and activities we really enjoy and we really like to participate in, but may not be quite on the essential list just yet. And then finally, all residents. You know, as we know, we're not in a stay-at-home order. We haven't been in an actual stay-at-home order for a while. But there are some aspects that we really want to strongly encourage for all residents. You'll hear us say it over and over again because it's that important. So we want to encourage all of our seniors and vulnerable populations to stay home. If you have a health condition, it's best to stay home whenever you can. Hopefully there's someone there that can help, maybe pick up your food and anything else that you need. But it's best to stay away from the virus still. The virus is still out there. We want to encourage work from home if possible. So remote work, we really want to encourage our businesses to continue to do that. We think that's very, very important. We want to encourage limiting travel outside the community to essential travel only. So that's a little hard. We know it's summer. We know people are excited to get out, but there are places in our state, there are places outside of our state across the country where the spread of the virus is going on faster than what's going on right here. And there are more people that have it. And so the best way to protect ourselves is to stay here and protect ourselves by not going to those locations. So we're asking people to try to limit their travel only to essential travel. And we want to also, as we always do, encourage physical distancing, increased cleaning, and hand hygiene. We think those are very, very important aspects. We can't emphasize it enough. That's why you hear it over and over and over again. Good hygiene, good distancing, that makes the difference. Thank you. I appreciate the opportunity to go through this, and we will have Cora Scott come up, and she'll be our frontline person to take some questions, and then the rest of us will try to help her as needed. Cora?
Thank you. Thank you, Jason, for taking the time to walk through that. In our previous press briefing, when we were discussing the order, we heard from you all that you really wanted to hear about it throughout the news briefing and not just read about it. So that's what we were trying to accommodate in that session, is to literally go through each section and explain it and then go to questions. So we will open it up for questions for media here in the room. Francis.
I've got a question. This is going back to the long-term care assisted living. We got a tip this morning indicating that a woman who was an emergency contact for her grandmother at Morningside was contacted last night and stated that there was an additional case on Tuesday. Could you address that, Clay, if that is accurate, and if so, give us a little more information. The woman indicates that the person who tested positive had to be removed from the facility.
So we're still sussing that out. It's actually a previous case, so it wouldn't be a new case. And so there's some question about whether, it's a positive, it's a residual based on a resolved case. I can tell you that we've authorized testing for the entire staff and all residents there, and those results should be in soon. So that's something that we're still working through. Obviously, always a concern, but in this case, from talking to some of our infectious disease doctors, there's a study out of South Korea that shows that a person who had tested previously and then resolved still was triggering the PCR test. So I think that's a long-winded answer to tell you that we don't know currently, but we're on it and we're working hard on it right now. Yep.
I have another question, Cora, and I'm sure it might be for the mayor or Jason. As far as enforcement is concerned, how are we moving forward again with making sure these numbers stick, essentially, and how about that be handled?
Well, as everyone knows, it's a pretty large community, and we know we can't be everywhere at once. Quite honestly, we have a lot of eyes out there, and we get contacted quite often with questions and sometimes with enforcement questions or complaints. And so I think, first of all, I want to say our community has done an excellent job. That's the first thing. Nobody's perfect, but if people weren't taking this seriously, the numbers wouldn't be where they're at right now. So just a big pat on the back for everybody. But it doesn't take long. We found that if someone decides to, maybe slip away from the restriction, try to do something a little different, there's usually someone there to let us know. And we're first about making a contact, trying to explain the situation, make sure people understand it, it's clear, give them an opportunity to do it. And that's worked very, very well for us. We've really not had to hardly have any formal enforcement at all, very, very little. So if we need to, we're there. We could issue a citation. We could even, if that doesn't do the trick, we could go as far as to look at possibly shutting down the business if we think it creates a significant health hazard. We've not needed to do that. I don't think we will, and so we'll keep talking with people as we get the opportunity, and I think we'll do fine.
Have there been any other citations other than, I think, the motorcycle riders or anything of that effect on as far as people are concerned, individuals? Anybody been cited that you can?
I'll have to look. I don't recall because we've had so few. I
don't think so.
don't believe so. Thank you.
Why do you think right now is the time to enter phase 2 when there has been a small uptick over the weekend in cases?
I'll let Clay get that one.
Yeah, so just to remind you that the case count is a lens that you look through, and 10 cases, 20 cases can be different depending on the nature of the cases. So we have to look at cases, we have to look at the circumstances surrounding them. Were they community acquired? Do we know where they came from? And you use that data then to inform. What we're really more interested in is our capacities to deal with them. So those come in our provision of health care. Can we provide health care without having to enter into crisis standard of care? That's very important, because if the level of quality of care suffers, that means that you've got your health care system stressed. We're not anywhere near that in that situation. Can you provide the public health capabilities of quarantine and isolation? And we can. We can manage probably up to 50 cases a day if we had to for a short stretch. That doesn't mean I want 50 cases a day. And then finally, can you test? And we have an abundance of testing. We're almost to 7,000 tests in this community. We've got some great opportunities coming down the road to even offer more testing for asymptomatic populations. And the testing numbers just aren't there. The health systems are testing people that are coming in for, surgeries. We're testing people every day in our mobile test site. We've done asymptomatic testing. I'm not seeing an influx of cases. So the cases that you're referencing, which were reported over the weekend, were cases that we were able to tie to domestic travel. There was only one case that we haven't quite figured out, but that's not enough to really slow this reopening down. If you look at any of the objective guidance that's been given by CDC, it always focuses on, have you had a 14-day sustained downward trend? Well, we've been bumping along at one case every other day. That meets that standard. Do you have enough testing? We do have enough testing. We have so much testing, in fact, that we can't even offer the full bandwidth that we have available. So I feel that this is the right time to take this step. But now comes the important part. Let's monitor the data. Let's comprehend what's going on. And if any of those capabilities start to get into that yellow, which the testing's there, but there's reasons for that. It's because we could stand up another test site and put it in the green if need be. But we need to monitor those capabilities, and if those get in the yellow, then we need to start saying, wait, what are we seeing? Is this a concern? And evaluate that at that point in time. So does that answer your question? Great, thank you.
Cora, to be clear, are these just guidelines for Springfield, not including county?
Yes, that's correct. These are guidelines, and the mayor's Phase 2 order specifically applies to the city limits of Springfield.
Why is that? Usually, we've been kind of in tandem throughout this process, and I think there might be some confusion, certainly for those of us who go in and out between county and city land, property.
Right.
What can you tell us about that?
Well, I don't like to speak specifically for the county, but there are differences in the activities and the organizations in a county than there are in a municipality. And so I think that played a role in why they decided to go a little bit different in the last order. Looks like the mayor has some additional info. Yeah.
Just point out, there have been differences in the expiration dates of the order. And so we were dealing with ours. The county's been operating on a little different time frame. So trying to meld those together is trying to be as consistent as possible, but still recognize, as Cora referenced, there are differences between many parts of the county and the city itself.
Could you give us maybe an example, just so that way I mean, because I'm not clear as to what that is, but maybe an example of what the differences are?
Well, look at the different types of communities we have within the county. Certainly, a number of municipalities, Walnut Grove, Fairgrove, Ash Grove, Republic, Willard, each of them are different. The densities of the population are different. The different types of businesses are different. And so when you look at what you can do in activities that are consistent between the city and the county, but as we look at the city itself, it's a much different demographic mix than what we see in many parts of the county.
And I might add, one of the biggest differences between the previous city order and the county order was that the county opted to make church services available. If church, they recommended against it, but they did make those available. This will be the first time that the church community inside the city limits of Springfield. But the mayor's right on target. There are differences definitely in population density that contribute significantly to disease trends as well. So there are, valid reasons why there would be looser restrictions out in the county than versus in an urban center.
And for you, Clay, before you go away, how difficult is that for you to balance? I mean, there's a lot of data, a lot of numbers, a lot of things you have to look at in order to make the proper recommendations to city and county officials. What kind of goes into that?
Well, I mean, that's a great question, but it doesn't really change the data. We look comprehensively at the county when we do our data analysis. So it doesn't matter if you live in Walnut Grove, Willard, Fairgrove, or Springfield, or Battlefield, and I left Stratford out. I'm going to make somebody mad at this point. So who did I miss, Catherine? That's a quick geography. Ash Grove, there's a quick geography test. But we look at the entire county rather than specific geographies. If you'll notice, we never report whether a case is a Springfield case versus a Willard case because we really don't see the utility in that. And I think we probably have pretty good geographic distribution. But the majority of cases are going to fall within your urban core. So to fully answer your question, it doesn't really create any headaches for us. We're going to communicate the data and our findings to the county commission and to the mayor and council on a regular basis so that they've got good information going forward as they create public policy.
Sorry, don't go anywhere.
All right.
Look, can we talk about contact tracing?
Sure.
I went and finally got my nails done, and the salon had me sign a waiver, but they were also keeping track of who was there on which particular day and their information just to protect themselves, but would use that perhaps maybe towards any contact tracing should a case develop at that salon. Is that helpful, and what can we do to continue giving you the tools as far as contact tracing is concerned?
Well, it's definitely not, it's not going to hurt. It's good to have that kind of data. If you'll recall, yesterday we announced a public exposure, and at the time we made that announcement, we couldn't give a time for the Walmart exposure. I think we've since been able to provide that data, but if we had that log, as you mentioned, that the nail salon had, we would have better definitive data. But we're always going to rely a little bit on people's memory and their recall, so it's certainly not a perfect science, but you'd be amazed at how quickly people can put those time frames together, and debit card expenditures help, but we're generally able to get a pretty good travel history from folks as we put those things together. Really, we're more interested in where they were when they were symptomatic, and so that helps as well. And then we're more interested in those intense contacts that they would have had. So we're talking about inside of 6 feet of somebody for more than 10 minutes typically would be a good standard to look at.
And how do you conduct that contact tracing? I mean, do you just kind of gather around everyone who could have been exposed and then test them for the illness? How does that?
So that's changed, and we're very excited about that change. When we were able to get testing capacity in the Springfield Greene County Health Department's lab, that gave us the ability to start to test all contacts that meet that definition. Before, we were simply quarantining those folks. But you're right. If you ended up getting ill, Francis, and I hope you don't, we would interview you. We would find out people that were in close contact with you during your infectious time frame, and then we would quarantine those individuals. So they'll still be quarantined now, but we'll also test them usually in the 5 to 7 day window from when they were exposed. And if we find that they're positive, we're going to repeat that process. That's a new tool that we didn't have before, and we think that's going to be very, very effective in continuing to suppress this disease in our community. So, anything else?
Not that I can think of right now.
Okay.
We have a few questions. Oh, go ahead.
Where did the formula for capacity come from? How was that decided?
The formula for capacity came originally from the governor in his original order. And when you actually do the math, maybe I should have Jason explain this. When you actually do the math, what it equates to is if you had a 6-foot bubble around yourself, and you're able to space out accordingly. But You can tell more if you want.
Yeah, it's really interesting. When it first came about, and that was guidance from the governor's office from the state on an easy way to calculate it, because otherwise people get caught up in this occupancy piece and before they even apply the percentage. And if you go back to high school math, you think about how do you find the area of a circle, right? And a circle, if I'm a pole in the middle of the circle, it's 6 feet this way, it's 6 feet that way. And when you do that, if you're a pole, it's about 113 square feet, plus or minus. If you presume the human has a thickness to them, it's somewhere between 113 and 120 square feet. If you go into this, you take the area of any building, divide it by 30, and multiply it by 25% or 0.25, you come up with a very similar number. So there was a methodology there that came from the state. We think it makes sense. So what that means is in a perfect world, when only individuals go into a facility, not families, only individuals, properly social distanced, they should all be about 6 feet apart.
All right, thank you.
And you will not be charged extra for that math lesson. We all got to go through that math lesson earlier, and it was fascinating. That's how we know how smart our city manager is.
This could be possibly for Clay. As we start opening up more and more and the restrictions evolve, I'm personally seeing a lot more people in public places. In other words, shopping, grocery stores. We still are recommending one shopper, one person per car, or a lot of stores are. However, I am seeing groups of families, groups of people going into places. What could you, once again, let the public know about the importance of sticking to what we've already developed in order to maintain what we've got?
So it's a good question, but before I answer it, I am going to tell Jason that some of us choose to not remember our high school math class because that wasn't my favorite subject, but as my mother is painfully aware of. So it's not a good idea to, go browsing the grocery store in a group. And the reason why is very simple, and I'm sure that people were tired of hearing me put this together. Density plus intensity, right? And that's how this disease works. Number one, it needs a sick person interacting with a healthy person. So one sick person with a bunch of healthy people, and you can end up with a bunch of sick people really quick. So it's better for those necessity shopping events to do the one person. We're not regulating that. We're not requiring it. There would really be no practical way to enforce it. But I think that you do highlight an important piece to the phase that we're entering. This is going to require increasing corporate and individual responsibility as we move forward, because that virus is not going anywhere. It's going to continue to stalk us. It will continue to make people sick until we have a vaccine or it infects about 60 to 70% of us. We can't afford to do the 60 to 70% because that overwhelms your ICUs and your healthcare system. So we have to do the physical distancing pieces. We have to do the hand hygiene. And maybe more importantly, don't go out when you're sick. That's pretty simple. Stay at home. If you've got a symptom that's related to COVID-19, we've got testing. It's not going to cost you money out of pocket. You can get that testing done, and we need to get you tested. So those are really the cliff note answers to that. Be responsible, be a good steward of our community, and let's all be healthy. Let's get through this together. We can do it if we do it right.
We do have some other questions. Jason Wirtz asked me to ask Francis if he could butt in for a second.
Oh, yeah, no, he has to wait.
Jason Wirt with the Ozarks Independent. It's a good question, Clay. It's kind of tricky. With the new order going into effect before Memorial Day, more residents will likely be taking part in activities and have more contact with others than a normal weekend. Was this move to Phase 2 made earlier because this weekend will be closer to the interaction likely seen in Phase 3, and this will allow the Health Department 2 weeks to see the level of increase of the virus during a more active time? So did we back it up to cover Memorial Day weekend so we could see more stats?
No, I don't think it was data. I think it was just feedback from the community and the data that we were experiencing. So This is going to give some of our faith community the ability to go ahead and start to worship if they want to this weekend. It definitely gives them a head start on planning if they want to do that the following Sunday. So definitely not something data related. You had to pull the trigger on this at some point, and why not reward the community on a Saturday before the holiday weekend? And honestly, I don't know how many of you poor folks end up staying in town like I always do. A lot of people go to the lake, but it's usually kind of dead around the community on a holiday weekend. So I think it's a good time to enter into the phase and not anything that would be data related.
Okay. A few questions related to church services. Asking for smaller religious entities that are 25 or less in attendance, do they abide by 25% of total occupancy, 25 people, or whichever is less? And I know we discussed this quite a bit, and I believe it is the 25% occupancy is what we landed on for that. And another clarification on the percentage formula regarding churches. Is that capacity in each room? Could you have live seated service in a main sanctuary and overflow rooms with screens, et cetera, based on the capacity of each room? And the answer is yes, because it's based on overall facility capacity and the individual room. If I'm wrong, you all chime in, please. Okay. Mary helped me with that one, too. Melinda Arnold, a PR friend, not from the media, but has a question. Multiple religious services are encouraged for social distancing, but we often recommend a 4-hour gap between the end of one service and the beginning of the next. Is that a recommendation or a requirement for churches? And I believe that's a recommendation. Yeah, it's not written into the order.
And I'd like to.
Sure.
I just want to throw one other thing out with regard to religious services. Remember, this isn't a recommendation that people that are in those high-risk groups immediately jump back in. Churches are going to need to find ways to protect those populations. We've seen numerous, faith-based outbreaks, and we just want to guard against that. We think it's important that those situations be thought through very clearly. We don't want to end up with a lot of people in the ICU without thinking that through, and we'll help you work through that if need be. 874-1211, and we can put you in touch with one of our disease control specialists.
I'd like to add to that if I could. It sort of jogged my memory. Oftentimes when we think of a building, whether it's a grocery store where it's the area obviously where the food is, or a department store where their merchandise is, or a church where the congregation sits, we often think of those large spaces when we're talking about spacing. But the fact of the matter is that it's the whole property. Right? So if I'm a business owner, if I have a not-for-profit and I control the property, church, whatever it might be, what we want people to do is to think about every place on the property that people could gather. So you start from the parking lot, not too big a deal usually. People start to come together as you get closer to the building. If it's a busy commercial type retail store, you might see people start to gather outside. It's important that spacing occurs outside as people wait to get in. It's important then that spacing occurs as people enter the facility. Then you think about common areas like lobbies. Sometimes they have restrooms. They have other areas. A lot of buildings have other areas, hallways, for example, where people can pass each other. Fortunately, they're not usually in those areas for a long period of time, but again, social distance, and managing of space. And then you think of the larger areas, and then you have what could be a cash register, and then the exit. So we're encouraging businesses and everyone who's responsible for the property to think from the very corners of the property to every aspect, every point of which people could gather as they go in and as they leave. And if they do that, I think we'll find that our numbers will stay in pretty good shape.
Okay, we had another question about the 25% versus 25 number, and I'm just going to reiterate, it is based on the 25% occupancy. This is a question specifically to hotels, conference centers. 25% occupancy, not 25, and we do use that formula, which is the total number of square footage divided by 30 times 0.25 for that. Any other questions in the room before we close today? We have all of these documents online. We have the PowerPoint presentation, the Road to Recovery Plan PDF document with all of this, and some additional handy tips for organizations and churches and individuals are all in that document as well. A news release kind of summarizing what you've heard today will be going out. Melissa's working on that diligently in the back of the room right now. I want to thank her for that. So without any other questions, we will close out for today. Thank you very much for joining us, and be safe.